Once a month, these ladies from Laverton in Melbourne's west get together.
Here's to health, wealth and happiness.
Good luck, ladies. Thanks.
Amongst the tea and pastries, there's talk of radiation, reconstruction and the one they all hope for, remission.
We're Western Buddies Breast Cancer Support Group, and then the little catchphrase is "we're your bosom buddies."
Today, the bosom buddies are getting to know newcomers Melita Shembri and Mary Spiteri. The sisters-in-law were both diagnosed with breast cancer in November.
No, I'm not having any treatment. I'm just on medication.
Yes, that's
good. And I started that a couple of months ago.
Yes.
I started chemo last week. I'm only getting 4 sessions.
Yes.
And I feel okay so far.
That's good.
Yes.
How many days?
Mary Spiteri's lump was detected during a screening mammogram last year.
I went for my 2-year mammogram.
Yes.
And then 20 days later I was recalled because they did find abnormalities in one of my breasts.
More than 15,000 other Australian women will be diagnosed with breast cancer this year. Like Mary, many of them will be picked up by Breast Screen Australia, which runs a free screening program for women aged 50 to 74. It recommends women be screened every 2 years.
Breast screening is one of those large breakthroughs. It's made substantial reductions in breast cancer mortality, and the evidence is overwhelming.
Thank you so much for this introduction.
But now a visiting professor is challenging the accepted wisdom that breast screening saves lives. Danish Professor Peter Goethe says having regular screening mammograms can do more harm than good.
What you have heard about breast screening is that it reduces breast cancer mortality usually by 30%, propaganda says. That's probably also what you have heard here in Australia. It's not true.
Professor Goethe is part of the respected Cochrane collaboration, an evidence-based movement encompassing doctors and scientists from around the world.
I have come to the conclusion that mammography screening is harmful. It carries no survival benefit, for example, and those who might avoid dying from breast cancer are neutralized or cancelled out by those who are actually killed by therapy they didn't need because they have an overdiagnosed breast cancer.
Professor Goethe says 50% of breast cancers are overdiagnosed, meaning that screening can detect what are known as harmless cancers that might never in fact develop. As a result, some women are getting unnecessary treatment.
Since we cannot distinguish between dangerous and harmless cancers, we need to treat all of them. And when you treat overdiagnosed women, that means healthy women with radiotherapy, you kill some of them because some of them develop lung cancer or heart disease.
Leading breast cancer surgeon Dr. Bruce Mann rejects the findings.
Yeah, simply not true. What he's referring to is the rare side effects of radiotherapy that can occur. Particularly with old radiotherapy techniques, the rate of heart disease was higher. That's being addressed by newer techniques.
Dr. Mann heads the surgical team at the Breast Service, a collaboration on breast cancer between the Royal Melbourne Hospital and the Royal Women's Hospital.
The true estimate of overdiagnosis is something like 10%, maybe 10 or 15%. It is not 50%. The idea of overdiagnosis suggests that there are cancers that, if left alone, would disappear. In clinical practice, I've never seen it. My colleagues have never seen it.
Professor Goethe reviewed the results of 7 clinical trials relating to screening, some dating back to the 1960s and 70s.
The evidence is very, very clear. All over the world, breast cancer mortality started to go down when we introduced effective treatments, which are, for example, tamoxifen and chemotherapy. And neighboring countries that introduced mammography screening 15 years apart, for example, Sweden started very early, Norway started very late. You cannot see any effect of that. Mortality started to go down in both countries at about the same time.
In the United Kingdom, there's also been debate about screening. In the city of Lancaster, Elizabeth Dawson writes an anti-screening blog. She was diagnosed with breast cancer in May 2013. Within a matter of months, she'd had a mastectomy.
It was an utterly agonising decision, and I'll never know if I lost a breast for no good reason, for a condition that might never have caused me any harm.
The UK has made changes to its breast screening programs after a comprehensive review in 2013 raised concerns about unnecessary treatment and the toxicity of radiotherapy. Women there are now given detailed information about the potential risks.
I think it could be improved further, but it does highlight the fact that overdiagnosis is a real possibility, and it also does tell women that treatment for early breast cancer may involve a mastectomy, which is what happened to me in the end, which is what I had in the end.
Professor Alexandra Barrett from the University of Sydney has co-authored a paper published today in the British publication The Lancet, which finds that Australian women are not aware that screening can pick up harmless cancers, which can lead to overdiagnosis and overtreatment.
In Australia, as in many countries around the world, an attitude is taken that we should encourage women to be screened because of the benefits of early detection. I think things have moved on, and that independent panel report that I mentioned in the UK, they concluded that it's a responsibility of a modern healthcare system to inform women not only about the benefit of screening but also about the downsides, so the risk of overdiagnosis and the risk of false positives.
Australia's national screening program began in 1991. In the most recent reported screening cycle, the years 2011 and 2012, a total of 1.8 million women came along for their regular mammogram. That's about 56% of the targeted population. Over the past several decades, the technology has improved, and so more and more cancers, particularly small ones, are being detected sooner.
We should remember that all screening programs do harm.
Professor Goetsche's views have spurred a new debate in Australia.
You've obviously said we shouldn't have screening because it catches cancers that would go away. It seems like, well, at some stage you have to catch the cancer.
Dr Bruce Mann attended an address by the professor last week at Melbourne's Alfred Hospital. He worries how women will respond to Professor Goetsche's message and insists the benefits of screening mammograms do outweigh the risks.
There are some people who have followed his publications and believe them, and I think they liked what they heard. There were clinicians who, I think many were horrified. We could see the consequences. You know, I don't want to have a larger proportion of the women coming to see me with large, more advanced cancers. It would be a tragedy.
To my mind, it's not about saying we shouldn't do screening or we should do screening. It's about how do we do it best? How can we offer it in a way that gives people information so that they can make a decision that's the best for them?